So yeah, quick introduction. So I'm Andrew Fenton. I'm with NHS South Central and West. We're an organisation that provides sort of support and services across the NHS, and we do a lot of work directly with NHS England and the team that Bola Owolabi leads, the Health Inequalities Improvement Team. So one of the things we do is kind of help coordinate and organise the Connectors Programme at a national level. And this session is focused on what do you see as the key ingredients for equal and positive relationships between the NHS with people and communities? So that's our topic for today. Really pleased to welcome three colleagues. Oh, can I just ask if people could go on mute? That'd be great. Do you use the chat to either perhaps say, if you want to say where you're from on this group, or indeed to ask, make any comments or questions? Just going to say very quickly who we've got with us on the panel today. We've got Joan Gabay from Greater Manchester, Core20PLUS Connector from the Caribbean and African Health Network, Tara Spence, Chief Executive at Homestart in Suffolk, and Tim and Vlogoff at NHS Hertfordshire and West Essex Integrated Care Board. So I'll ask them to just introduce their roles as we go through. And say what they do briefly, but really this is the structure is that starting with Joan and then Tara and then Tim, just giving a few sort of 3 or 5 minutes just for them to make a few comments really, or observations on that topic around key ingredients for equal and positive relationships. And then we'll wrap up with some sort of 5 or 8 minutes really of just a bit of discussion, panel discussion between us. But if there is anything you want me to particularly ask about or comment on, then do use the chat. So I'm going to hand over to Joan, who's going to talk us through some of her experiences and reflections from the great work you've been doing in Manchester. Thanks, Joan.
Hi, I'm Joan. Hi to everyone. So yeah, I'm a community connector for Cairn, and I'm been working since February 23, and it's an amazing role. I love it. So I see it as the reason why I did this role was because they were looking for people with lived experience. So I applied for the role because sadly my father passed away from cancer and me and my siblings looked after my father. So I wanted to do something that could be positive in the community. So what I do is I work alongside the NHS Health Coordinator for the Withington and Old Moat area in Manchester. And we were doing 2 campaigns last year, which I worked alongside, which was bowel screening and cervical screening. And we actually put on an event for men's health to do with the bowel screening at Withington and Old Moat, which was one of the first ones they've done in that area. For me, the ingredients where we talk about for the partnerships is I feel like the most important thing is communication, engagement and listening skills. And I found that taking that into the communities and working alongside the NHS coordinators, the GP leads, you've got the stakeholders and businesses and community residents. That is really key to actually taking the time, listening to people's stories, because everyone has a lived experience, and looking at ways to improve it. And I feel that it's a really important role, and having like evidence-based research that can't do that we can work alongside with that information that we have, and to get the correct information over to the community to improve. It's almost like that connector's role is being a connector, because you're actually bridging that gap that is there, and to have trust, which I think is really important, and that engagement, because if you build trust, and it's almost like the people in the community is their voices being heard for the health inequality that they may have experienced. And a lot of the times, if they're not clear on if it's a diagnosis, if they're not clear on it and how to go about finding out the correct information, we can work together with the GPs to get that information across, whether it's language barriers that it could be, and how to connect, and the best ways actually talking to the neighbourhood communities and businesses to find out how we can engage everybody, so that it's kind of like building up good relationships.
Thank
Yeah.
you, Joan. Some really great comments there. I've just put in the chat actually that phrase really you spoke about: communicate, engage, listen, and of course building trust is crucial. And we'll come back to some of those themes, I'm sure, towards the end. So yeah, it's great to hear from Joan as someone who's working in, very much at the kind of front line of being a connector, community Core20PLUS connector, working for or with Caribbean and African Health Network in Manchester. So gonna move on to Tara from Home Start in Suffolk. Tara, welcome, and bringing a voluntary sector organisational perspective. Thank you.
Thank you very much. Like you said, I'm Tara. I'm from Home Start Suffolk. I'm Chief Executive there. Home Start's a family support charity, and it operates within the Suffolk and North East Essex Integrated Care System area. So as well as my role within my charity, I also sit on our local ICS Voluntary Sector Assembly on the steering group, and that also means I have a seat on our Integrated Care Partnership group. So when I started to think about what are those key ingredients for equal and positive relationships, I started to think about what would I want? What would I do if I was in that position? Where would I turn? And I started to think about it in terms of an example. So imagine that I wanted to gain, say, some experiences of primary school children, and you will have to bear with me for my example. If I turned up to a primary school gates and started talking to children, other than being arrested, or hopefully get arrested, because you wouldn't certainly want anybody doing that, why would those young children, why would they start talking to me? What would actually, motivate them to tell me how they felt, what their experiences were? They don't know me. They don't have a relationship with me. They might not understand, or hopefully they wouldn't understand my intentions for being there. I might not speak their language. I might not understand their culture. I might use the wrong terms. I'm certainly not cool, hip and trendy like primary school children anymore, so I might use the wrong terms. And I wouldn't necessarily know that if they did tell me something, that the information they would be telling me would actually be accurate. How would I know it would be helpful? So I'd have been much better and got better outcomes if I'd have gone to the school and I'd said to the school, actually, I need this information. This is why it's legit. Can I work with you? Can I collaborate with you to get this information? And then those trusted people, those people that are trusting those children's lives, teachers, pastoral support, they would then engage with those children and young people, and they'd have already formed a really close, trusting relationship with them. They'd know the best way to talk to them. They're probably a bit cooler than I would be. They'd know how to make sure things are accessible, and they'd have the right environment. They'd be an enabler in that conversation. And that's what I believe the voluntary sector is when we're looking at those equal and positive relationships. The voluntary sector, although it is, in many cases free or low cost on entry to people and communities, it's not free to run. And so if we have a voluntary sector that is sustainable, well managed, well led and resilient, it's got to be properly resourced, and it's got to be properly funded. So over the past couple of years in Suffolk and North East Essex, I've been working with our voluntary sector on something that's called a resilience charter, which started off as a set of principles or draft principles that we...
Sorry, I think Tara.
Or have you gone on?
That's okay. I think I got muted, but I'm going to unmute. So, like I said, I worked on a set of principles, draft principles, that were agreed by the Integrated Care Board to have some support and resource to allow us then to collaborate and work with a number of partners across the system. And those principles looked at things like trust and culture, co-production, sustainable funding, quality and monitoring. And we gained, it was fully co-designed by system partners. We had over 59 organisations contributing to the co-design process. There are lots of different groupings of people worked really well to look at the challenges and obstacles. And what it meant is that we got to the summer of 2023 with some agreed principles that were signed off by all anchor partners, and they looked at how we strengthen the voluntary sector and ensure that it is there to engage with people and communities so we can open that dialogue. So I think, in short, if we are going to ensure an equal and positive relationship with people and communities, the NHS need to lean on the voluntary sector. The voluntary sector do it well. That's what people see them for. They're embedded in communities. But the reality is that the NHS need to hold up the voluntary sector. They need to support them properly to ensure that they are supported to be lent on. Thank you.
That's great. Thank you. So I was just typing in a few notes in the chat to help capture some of the key comments. I like that point about both supporting and holding up the voluntary sector in order to lean on them, as it were, to get to work productively through and with the voluntary sector. Tim, over to you. You're with an integrated care board, aren't you? And you've got an interesting role around community resilience. So tell us about your thoughts on this topic.
Thanks. Hi everyone, and I think Tara, you are cool, and Joan, you're very cool too. What Tara was talking about, particularly around what I think you call an assembly, we call the VCFSE Alliance in Herts and West Essex. And my role.
Sorry, Tim, your audio is a bit distorted. I don't know if other people have got any problems, but
can everyone hear me right?
That's maybe a little bit better if you're closer to the microphone. Thanks.
I'll lean in, but you'll get to see my face in more detail, which is a bit scary. Yeah, I was just saying, Tara referred to the assembly. I think that's the same as the VCFSE Alliance. And in Herts and West Essex, what we've done is draw up a health creation strategy. So a positive way of framing prevention, really. But and obviously, you've got Maren in the other group talking about health creation. And really, that's about how we work with the voluntary sector to address a whole bunch of things. There are 10 things, one of which is health inequalities. So as Tara was saying, the voluntary sector is key in nearly all of our communities. It's sometimes stronger in some of the less deprived communities, which is an issue I think we need to look at in terms of capacity. But what's really important is that we do have the focus that Bola was talking about earlier on the data and what's going on locally. The connector schemes have been absolutely amazing, really good work. But of course, what the community is looking for is reliability on the part of partners like the NHS. And the trust thing depends partly on sustainability, and that's one of the real challenges for all of us, because obviously funding is not straightforward. But I think the other thing I just wanted to quickly say is that it's really important we work with all the partners. So, for example, one of our sites is in Boreham Wood, which has got the most deprived community in the whole of the ICS. But the district council have been critical in helping make sure that people get smear tests and other things with money from public health, which is of course the county council, as well as the work with churches, synagogues, and the rest of it. So I think it's really, really important, especially when resources are so tight, that we do all work together in an integrated way, based on the evidence we've got, with real trust and partnership between us.
Okay, thank you, Tim. Yeah, I've taken a couple of notes there about your comments. It's interesting you're adopting that health creation approach, really kind of that strengths-based, assets-based approach, which relies heavily on building trusting relationships and connecting with people, and as it were, giving voice and kind of power shifting, and like the phrase about trust needs sustainability, and of course working across multiple partners within sort of systems, with the voluntary sector, communities and organisations, local authority, public health, and of course the NHS. So some really important points there. So we've got about 5 minutes or so really just to have a bit of a further discussion. And then if anyone's got, I realise the chat actually isn't specific to this room, but if you did want to make a comment or question, then just type in the box room 2 so we know it refers to us. But interested, so what you each said in a sense demonstrates quite a lot of positivity about what you can achieve through building trust and connections with people and communities. Equally, Tim, you spoke about sustainability, and Tara, you also referenced the need to the proper resourcing of the voluntary sector. So just to touch on those sort of key issues, and Joan, your thoughts as well, really around the issues around sustainability and funding. Are you seeing any I mean, of course, this may not be the case, but are you seeing any improvements in the funding of the voluntary sector, or is it getting harder out there in terms of those issues around sustainability and the funding question? Tara, do you want to kick off with that?
Yeah, happy to. So it's certainly no easier, but I think if I look locally, obviously there are cuts everywhere, and we've got to be realistic that when there are cuts, every service gets affected. I think what having the charter has meant is not necessarily, it's very early days, so it's not necessarily seeing lots of extra money. It doesn't create any money. Papers don't create money, but what it does create is a mechanism to ensure that there is kind of parity and fairness across the sector. And so where something maybe isn't working, where maybe an organisation hasn't considered the charter principles, there is a forum for the voluntary sector to come together with system partners to actually go through and understand why it hasn't happened and try and correct things, so that we can then ensure that it doesn't happen again, and you know, that we can make sure that actually there is sustainable income coming into the voluntary sector.
Yeah, exactly. Yeah, gives that sort of strengthens, I suppose, the connections, doesn't it, across the system, and perhaps makes funding more likely, even if funding is still more is very tight. Joan or Tim, any sort of further thoughts on that issue around?
Yeah, sorry, I was going to say that I've noticed, I think what it is sometimes with the funding is that people haven't got an understanding of what's available. So sometimes, so when I'm in the Withington Oldmore area, there might be, because I'm working with the NHS Health Coordinator, I know about information that's coming through now because they kind of have that to hand. But I think in the communities, a lot of times they don't know what is available for them, what funding's there. I mean, Cairn are amazing. I know Peace on the call in June, and they're fantastic in the way of they've got so much information, and they are so supportive in the role that I do. So a lot of the times I can go to them to ask the questions, and they're very quick to respond. And so I think talking to business, even going into the Withington and Oldmore area, talking to businesses, I had a business owner that it was a bit slightly different, but it's still to do with it was to do with lupus, where she was noticing her clients, where she noticed there were more clients coming in from the Black and African Caribbean community that were presenting with this, and there wasn't enough information. And there's something where, again, she thought, is there something she could do? So I think sometimes there's maybe even the Core 20+5, there's other areas that come to light. And again, as Peace, who's on the call, I reached out to her and she had ideas, and even the NHS Health Coordinator was seen as, because it was a business, it might not be ready available, the funding, because it's a business. So there's things like that can happen. And I think with this event, I mean, it's National Voices, it's people to be heard. It's a great name for it anyway, but it's actually getting that over to the communities. And I think that the consistency has to be there. And even with a different trust with the NHS, sometimes if they're in certain areas, it's to work alongside each other. And exactly. I think that can help as well. And I know the funding sometimes is cut and it's restricted, but I think because it's such an important thing with the health inequalities, sometimes it's not just in one area. I think it's people connecting from different areas to work together. Because I think then it's almost like the voices that we're talking about, the national voices, if it's not, it should be national then. And then I think you could actually have listening groups with people that are affected with lived experience, and actually then presenting questions with surveys. And I think it could be having that support. I mean, even I would say going to counsellors in the areas, because I think sometimes people feel restricted and are sensitive to even talking about Black African Caribbean. And if it's something where they're trying to engage with a certain community, it can be this, from the GP leader say, sometimes it can be quite sensitive. Where if they had a Black and African Caribbean person that represent and then talk to the stakeholders, you might get a different approach.
You might get, there's sort of trusted voices really, and there's key connections into different sort of communities. And in the last sort of couple of minutes we've got, Tim, do you want to come back in for a few thoughts on the topic?
I think the way we create sustainability and funding is going to be partly about visibility of all of this stuff. So, for example, you know, the discharge of someone who's just had a COPD flare up back to a cold, damp home with mold on the walls. If we're not thinking about the mold on the walls, we're only thinking about what we do in hospitals, then we're not going to improve the health of the population. And we're in the middle of a huge cost of living crisis, all of this. And actually, thanks partly to having the health creation strategy, last winter we did get the NHS to put some of its winter money into benefits advice and stuff to help. And that was a non-clinical investment, but which had clinical positive clinical outcomes. There's lots of national research that shows that.
Yes.
Things are so tight at the moment that we really have to show both, make all this stuff visible, show that those social impacts are huge on what happens to people and the use of the health service. And then, as has also been said by everybody, make sure everyone's working together, understands each other, and knows where resources are, because some are underused and some are massively, you know, people are waiting for a very long time, and people from the most deprived communities are more likely to be on waiting lists.
Yeah, exactly. That's
really
definitely the case.
To sweat the assets, but
yeah,
ultimately we do need to increase the amount of funding available for this stuff.
Yes, yeah, exactly. Yes. So some really good observations there. I think we're probably going to be running out of time in a moment, but just to emphasize a few key points. There's obviously all the issues about the importance of very strong connections, building trust, listening, being equal partners and equal voices with the NHS and other statutory agencies. I like that point about visibility, Tim. You mentioned about, you know, making sure there's visibility of all the key issues, and the really important connection between the sort of social factors like housing, you know, dampness, other factors, pollution. So we've got just under 1 minute before we're kicked out. And reminds me actually of work we've done with Oxfordshire on a Better Housing, Better Health programme, where they were investing, the public health team were investing in housing interventions, housing support, and that we had a look at from an evaluation perspective to see what kind of impact it's had on health. And as you expect, there is some, you know, reasonably positive evidence that there is good evidence of improving people's insulation or warmth, particularly in the current cost of living crisis. So working across these issues around upstream social determinants, as well as the specific clinical issues like blood pressure checks or access to screening, for example, that Joan spoke about. So I think we're just about out of time, but thank you, Tim, Tara and Joan, for speaking and providing some really, really powerful and valuable comments on those key issues.
Hello and welcome back to the main plenary event. I joined Breakout session 1, and just, a huge thank you to the speakers. It was really useful to hear the stories within that session. And just to let people know as well, each of the 3 breakout sessions were recorded. So if you wanted to tap into the resources for the other breakout sessions that you couldn't get to, you could do that at a later point. So just thank you so much to all the speakers in those breakout sessions. I certainly learned so much in just a very short amount of time. That really brings us then to the end of the second session of the day. We're now going to have a break until 4 p.m. And the next session will be on making the work carried out in the Core20PLUS Connectors Programme sustainable. So please get up, move around, have a cup of tea, have a biscuit, treat yourself, and come back and join us at 4 o'clock. As with the last session, I think if you can stay on the Zoom call, but just pop yourself on mute and pop your video off, that'll be perfect. It means that we won't have challenges with people coming, being readmitted back into the meeting. And if you're a speaker for the next session, then I'll do a little tech check with you during the break. Thank you all so much, and see you in 15 minutes.